President and founder of Lyme Warrior, Arthur Ebeling. Good you're here today.
Thanks for having me.
Please describe your own experience with Lyme disease.
Well, I first became symptomatic with Lyme probably nearly 10 years ago, and the diagnosis eluded detection for many, many years for that 10-year period. So in 2010, my symptoms became more critical, and that's finally what eliminated the diagnosis. But at that time, it had already proliferated throughout my body. It attacked my brain, my heart, my eyes. So, my vision was under assault. I was facing the potential for severe permanent neurological deficit. So, by the time it was discovered, it was a very critical situation. And unfortunately, this is characteristic of a lot of Lyme patients. They're symptomatic for many, many years. They're often misdiagnosed with other disorders or undiagnosed altogether. So, my case is very typical of a lot of people with later stage and chronic Lyme disease.
And what exactly is Lyme disease?
Well, Lyme itself is a bacterial infection caused by the Borrelia burgdorferi bacteria. There are many strains of Borrelia, some more virulent than others. Lyme, if detected early in its acute infection phase, can be treated very swiftly and effectively with antibiotics. It's when it emerges into the second and tertiary stages that it becomes far more complicated to treat. What we're finding now more and more is that Lyme is not often just a singular infection with Borrelia, but it's often a complex of different pathogens. In my own case, not only did I have Lyme, but concurrent with that I had babesiosis and Bartonella. Again, we're seeing this more and more, the presence of co-infections, which obfuscates the diagnostic procedure, makes it harder to detect Lyme. And some of these co-infections are antibiotic resistant, so it can become far more challenging to treat. So, Lyme, in short, is really a complex. And in latter stages, we're finding that it can activate autoimmune disease, can maybe even activate certain genetic predispositions. So it's a very sophisticated disease. It's something that, again, in these latter stages, it's very, very hard to treat.
Okay, now, can Lyme disease become chronic? And if so, why is chronic Lyme disease so controversial?
Lyme unequivocally can become chronic. I myself suffer with it currently. It's something I'll probably have to manage for the rest of my life, barring certain medical discoveries. The reason that chronic Lyme is so controversial is really predicated on the absence of a very effective, accurate diagnostic screening test for Lyme. To give you an example, the enzyme-linked immunosorbent assay, which is the standard blood test that's administered for Lyme disease, produces anywhere from a 50 to 60% false negative. In my own case, I tested negative on the ELISA. I wasn't tested until close to 10 years again after I was actually infected. By that time, the test really lacked any sensitivity. A lot of the tests that are in place for Lyme are antibody-based. The problem is that Lyme antibodies often appear only 6 weeks after infection, so there's an incubation period. All right, so these tests aren't going to be sensitive in any way in that 6-week incubation period. By the time the disease is actually eliminated, for a lot of people it's very late, and again it's allowed it to advance into these secondary and tertiary stages. So again, Lyme is very much can become a chronic illness. The reason that the controversy is there is because in the absence of an objective measure, because these tests aren't very accurate, if a patient does not test positively, many practitioners aren't going to make that leap to say you do have Lyme. So the Lyme diagnosis is very complicated. The scope of diagnosis includes not only any objective measure, but also a clinical assessment considering symptoms that the patient is presenting with. But again, a lot of doctors are not comfortable making that leap, and some cannot do that without sanction by insurance companies and so forth. So one of the most fundamentally important things that we can do in addressing Lyme and more effectively treating it and diagnosing it is to develop more effective early screening measures. But again, we know that Lyme's chronic. Part of what contributes to this is, again, these late diagnoses that allow it to become multisystemic. Lyme can antagonize any part of the body, the brain, the heart, the endocrine system, anywhere in the body, Lyme can go. So, that can confuse diagnosis as well. But the longer this persists, the more complicated it is to treat. And then when you talk about it activating autoimmune disease, triggering certain genetic predispositions, And we've also found with Lyme itself, the Borrelia burgdorferi bacteria itself, that it has a morphogenesis into cis and L forms that render it antibiotic resistant. So that also contributes to the presence of chronic Lyme. People that have these forms, the cis form or the L form, may not recover from antibiotic treatment. So that's another thing that contributes to it becoming chronic. And like I said too, the presence of these co-infections like Babesia, like Bartonella, like Mycoplasma, they all contribute to a chronic pathology potentially.
You say Lyme is one of the biggest health crises of our time. Explain.
Well, I really believe that Lyme is certainly one of the greatest health crises of our time. I think it has been for a long time. Part of the reason I say this is because it's been so grossly undiagnosed, unreported. And to give you an example, you have roughly 35 to 40,000 new cases of AIDS every year. Lyme, by comparison, you have anywhere from 300 to 400,000, possibly more, new cases a year. Now, historically, the Center for Disease Control and the Infectious Disease Society of America have been in part responsible, given their diagnostic criteria and their treatment guidelines. They've been partly responsible for this disinformation about Lyme. But now the CDC has amended their earlier estimations of Lyme incidence to reflect a tenfold increase, not only current day, but retroactively. So they even acknowledge now that we don't have 30,000 new cases of Lyme a year, we have over 300,000 new cases of Lyme a year. And again, consider this applied retroactively over many years. Effectively, this distills to millions of people that have Lyme disease that have not been diagnosed. And when you start to examine the correlative between Lyme disease and various neurodegenerative diseases like multiple sclerosis, Parkinson's disease, Lou Gehrig's disease, even Alzheimer's, as well as various autoimmune dysfunctions such as lupus and a lot of idiopathic diseases that seem to be more and more common, such as chronic fatigue syndrome, fibromyalgia. I think what you're going to find is that the reach of Lyme is so prevalent, is so pervasive, and more research is going to continue to elucidate that. That's part of what we're doing at the Lyme Warrior Foundation. Part of our research efforts are directed to illuminating just how far this reach is and the correlations between Lyme and these other diseases. And also, our research is directed in developing that test I mentioned earlier, developing a more accurate test so that patients can get the care that they deserve to have. And finally, better understanding Lyme's morphogenesis, like I mentioned with cis and L forms, better understanding that behavior and advancing more effective long-term treatment strategies. I want to say in closing that currently the Western model is to hurl antibiotics at the patient, and a lot of patients who are very sick require long-term antibiotic therapy. And this is something that has not been very much endorsed by mainstream medical establishment because long-term antibiotic therapy communicates its own risks. And these risks are very valid, but for a lot of patients it's the only resort. So, I believe that patients deserve long-term antibiotic therapy, but I also believe that there are more effective strategies that we can develop to more, efficiently treat this disease.
Arthur Ebeling, the Lyme Warrior Foundation.
Thanks for having me.